Started by asking him what he'd say to one accident and emergency consultant in Stoke who has publicly apologised to patients for the third world conditions at his hospital.
Well, what I would say to all NHS staff, first of all, a massive thank you, not just from me, but from the whole country, because they are working under extraordinary pressure. And it makes me very proud, actually, to see how extraordinary the NHS is in what is our busiest week of the year. Stoke is one of the most distressed hospitals that we have in the NHS, and I don't think that what's been happening there is acceptable. And we're doing everything we can to support the staff at Stoke. It's not their fault, but there have been some problems in that system. But actually this week there are problems everywhere because this is a very, very busy week, and we have prepared, I think, better than in previous years. But that doesn't...
not well enough.
Well, there are some differences. We planned for an increase in activity this year, but I mean, the North East Ambulance Service talked about a 30% increase, and we planned on the basis of the increases we've had in previous years, but some of the spikes have been higher. We've also had an uptick in flu. We're not sure yet whether it's going to be an epidemic like they had in Australia, but definitely been an increase.
Pre-budget, pre the moment when you asked Mr. Hammond for more money, and you asked for more money than he gave you.
Well, I did particularly... There's a bigger issue about NHS funding, which we can come to, but I did particularly ask him for some support for this winter, and he found £337 million, which I think was more than the NHS was expecting.
But it came late.
Well, we've used it to very good effect. I mean, I think one of the biggest pressures that you have at this time of year is beds. And this week, because of that money, we'll have an extra 1,100 beds in service across the NHS. But I think there is a broader issue about NHS funding because of the ageing population that we need to address as a country as we come to the end of the five-year plan that we're currently in.
But in a sense, you've known that all along. For 3 years, this moment of crisis has been advertised very widely, that in fact, by 2018, unless there was a profound change in the way in which the NHS was funded, you wouldn't make it past a crisis, and you haven't. You've had to postpone all these operations. What do you say to an elderly woman who has a hip operation and is now going to be probably immobilised by the fact that she can't have the operation?
Well, I'm the Health Secretary. It's my job to make sure that that lady gets her operation in time, and this January a number of people will have their operations postponed. And even though we're doing every day 5,000 more operations than we were when I became Health Secretary, for that particular lady, it is a very, very big deal. She may be in pain, and so I can only apologise to her and to many others in her position.
Why are we staggering from crisis to crisis, when in fact, if you were strategic, you'd say, come on, we really need a 10-year plan. We know what's going to happen in these 10 years. Let's go for it.
Well, that is exactly what I think we do need going forward, but I think it's important...
So that's official. The Secretary of State says we've now got to fund the NHS on a 10-year basis, 10 years by 10 years by 10 years.
We're in the middle of a five-year programme of reform being led by Simon Stevens, the Chief Executive of NHS England, and I think as we come to the end of that programme, we do need to look forward, and I would argue that we should look forward not just 5 years, but I think we do need to look forward longer than that, because it takes 7 years to train a doctor. But I think it's important to remember that what we're going through at the moment in this our busiest week is the same winter pressures that they had in Australia when they had their winter, that they had last year in France when they had 1 million people with flu. And we're not unique in having particular pressures around this time of year. When it comes to the long-term funding issues, of course they matter. But I think the record of since 2010 is really a story of two halves. I think in the first half of that period, we had the financial crisis, we had the risk of a financial meltdown, there was a very challenging period of austerity. But in the second half of that period, we have seen significant extra sums of money coming into the NHS.
But clearly not enough. If you could ask the Chancellor for what you need, what would you ask for?
Well, I don't think the Chancellor would like me to answer that question on your show, John, but what I would say is...
Well, it's not entirely clear that he's really very sympathetic to your plight.
Well, I think you have to look at what the Chancellor delivered in the budget we just had, which was an extra £2.8 billion.
Which was probably about 1.8 billion less than you asked for.
But I think to answer the question, you have to go back...
You don't deny it.
Well, to answer your question properly, you have to go back to that doctor in Stoke and what is on his mind and the minds of doctors and nurses across the NHS is that there is too much pressure year in, year out. And what you need, and the prior question to funding, is what staffing levels do you need?
What one senses is that Brexit is immobilising you all, and you seem unable to focus on what is really happening to the population of this country.
Well, I totally disagree with that. In the period I've been Health Secretary, we actually have 40,000 more doctors, nurses and clinicians, which is a very big expansion, and I think there's a real recognition of the importance of the NHS. It is true that demand has gone up by faster than resources, but it's also true that if you look at the public service that's been the biggest winner since the economy has got on its feet, 2-3 years ago, it's been the NHS.
But somebody hasn't got the sums right yet, and the people who are suffering are the people waiting up to 12 hours. We have reports of people waiting in A&E to be attended to. And what do you say to them?
Well, what I say to them is that, first of all, when we don't deliver the high standards of care that we aspire to, that is my responsibility. And as I said before, I apologise unreservedly where we don't get it right. But what I also say is that we are one of the only countries in the world that has a 95% standard for A&E. Other countries like Canada...
Well, at the moment, it seems the Royal College of Emergency Medicine is saying 40 to 50% of patients are now waiting more than the 4 hours that you've stipulated. I mean, that's and when the target is 95%.
Well, compared to 7 years ago, we're actually treating
That's no comfort to the people who are waiting.
No, but let me say, we are treating 3,000 more people within the 4-hour standard. So we're seeing a big expansion of our capacity. But do we need more people? Do we need more doctors? Do we need more nurses? Of course we do. And the way we do that, because we have a taxpayer-funded system, is we have to have a strong economy that generates the tax revenues. But if I just give you one decision made by Theresa May, which shows our commitment to the NHS in the long term. In her time as Prime Minister, we've seen the number of doctor training places and nurse training places increased by 1/4, the biggest increase in the history of the NHS. The only long-term solution is to have the numbers of doctors and nurses that we need. Now, unfortunately, it does take 7 years to train a doctor, 3 years to train a nurse. So we're going to have to ask staff in the NHS to bear with us as we train those extra numbers of doctors and nurses. But what do we want? Well, you know, an American think tank, the Commonwealth Fund, rated the NHS as the best healthcare system in the world. That's what we want as a government, and that's the long-term commitment that we are making with these decisions.
Secretary of State, thank you very much indeed for